The following program is brought to you by Wightman TV. All content in the Stay Strong, Live Long Falls Prevention Education series has been created for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this television production.
Welcome to our Stay Strong, Live Long education series on falls prevention. Brought to you by the VON, the Upper Grand Family Health Team, and our community partners. Falling is the leading cause of injury-related death among seniors and the #1 contributor to loss of independent living. In fact, 1 in 3 seniors 65 years and older will fall each year, and falling just once doubles your chance of falling again. It is our hope through this Wightman Telecom production that we can change these statistics in Wellington County, empowering our community with the knowledge and tools they need to prevent future falls. Today's session is brought to you by Holly Stokman, and Holly is our metabolic nurse specialist with the Upper Grand Family Health Team here in Ferguson, Elora, or as part of Centre Wellington. And your session today, Holly, includes foot care and peripheral neuropathy. Is that correct?
That's correct.
Great. Thank you so much for joining us.
Thank you for having me.
Okay.
So welcome everyone to today's focus topic discussion on those darn feet. I'm going to talk to you a bit today about our nervous system, what happens when we have nerve damage, and how that affects our feet. How do we care for our feet? What do we wear on our feet? Okay, so first of all, how do we know where we stand in our physical space, in our environment? Well, our brain needs to interpret what we sense and then help us to respond to things that change in our environment. So we respond to things that we sense, right? Our things we see, things we touch, things we smell or hear, and then we interpret that information and we should be able to respond as necessary. And this works through our peripheral nervous system and our central nervous system. So if I can direct everybody to the diagram up on the screen, we see a picture here of the central nervous system, which consists of the brain and the spinal cord, and then the peripheral nervous system, which is all of the nerves that extend out to all the other body parts, okay? So these two communication systems work together, sending information to and from our fingertips and our toes, back to the brain and back out to those body parts so that we can be aware of how our environment is changing. So we have sensory receptors that I alluded to. So in the skin, for example, we have sensory receptors, and again, these are going to send information to our central nervous system. And these include things like sensory receptors for pain, sensory receptors for changes in temperature, pressure, vibration, okay? All of these types of things. Then what happens is that the central nervous system, or the brain, sends a signal in response to that sensation out to motor endings on our nerves to enable us to move our muscles. So the nerves, motor endings on the nerves on our muscles, and that enables us to move in response. So most of the time this is voluntary, right? If I'm walking, if I'm going to sit or stand, pick something up, this is all voluntary movement. But sometimes this is also involuntary, such as when the muscle of our heart beats. One way we see this interaction between our central nervous system and our peripheral nervous system occurs when we look at reflexes. So again, I'll direct everyone's attention to the diagram on the screen. It's showing on the left-hand side of the screen a picture of a pin or a needle poking through someone's skin, and that pain sensation travels to the central nervous system to be interpreted, and then that central nervous system is sending out a motor response so that your muscles can move in reaction to that, okay? Another way that this could happen is, say for example, I'm walking along. So walking along happily and I trip and I'm going like this and I'm flailing, and this is all my reflexes in action. So I am trying to regain my balance. So we need these sensory receptors to inform us of where we are, and this reflex helps us to respond quickly, okay? So it helps with things like balance, things like posture, and also response to pain, as was explained through the diagram. Or say, if I held my hand over a burning candle flame, right? I sense the hot temperature. That signal is sent through the nerves, and the nerves also send a signal out to the muscles so that I can respond. Same thing. I'm going to draw my hand away quickly. Another way that our nervous system helps us to understand where we are is through something called proprioception. So this has to do with special sensory nerves that are more specifically located in our bodies. They are found in our muscles and our connective tissues, and they respond to stretch. But the nervous system helps us to understand things in this way by knowing where our body parts are in relation to one another. So it allows us to do things, for example, like touch our hands over our heads, or behind our backs. I can touch my knee up to my hand, okay? I can even do these things though with my eyes closed, right? So it's always informing me, this proprioception, of where my body is in relation to each part. But it doesn't work, obviously, if I were to close my eyes and try to reach out and shake your hand, right? I'm gonna miss. Or if I'm reaching for a glass of water on a table, again, there's no signals coming between my body parts and your body parts or an object outside of myself. So I'd like to try a little activity with everyone here today, if you're comfortable and you feel safe to do this. If not, it's totally fine to sit it out. And for those of you at home, if you would like to participate as well, please do so. So what I'm going to ask everyone to do is to please stand up, okay? And we're going to move to the back of the chair. So I'm going to do this as well. I'm going to move this chair here and just show you what I mean. So you want to stand behind your chairs so that if you need to, you can hold on to it for safety. Okay, so just make sure it's within easy reach. Okay, so standing there with or without holding on, as you're comfortable, just take a moment. So your feet are flat on the floor and your head and your neck are straight and your arms are just hanging at your sides. Okay, so thinking about what that feels like, just standing there. And now what I'd like you to do is close your eyes for a few seconds. Just keep your eyes closed and focus again on just the sensation of standing there. Okay. Now go ahead and open your eyes. All right. Have a seat. Everybody can have a seat. Did anyone feel anything different when they had their eyes open to when they had their eyes closed, just standing there?
Yes.
Yes.
Yes. What did you feel?
A little bit of a sway.
Swaying. Okay, yes.
I think I was noticing my body posture more as well with my eyes closed.
Okay.
Yes.
More aware of posture with your eyes closed. Exactly. So we don't realize just how much we rely on our sight to inform us of where we are in our physical space. And it's not until we lose this ability or it's greatly reduced that we become acutely aware of all those other ways we sense where we are. And how do we know where we stand? That swaying, that's the sense of the pressure on different parts of our foot informing us of our balance, of our posture, of where we are. So we need those sensory receptors in our feet. And just a note to safety while we're on the subject. So obviously, you always want to be aware of your physical surroundings, right? You don't want to block your vision. If you are walking along somewhere, you don't want to be staring at your feet, but if you had to look at your feet, you want to be able to. So avoiding blocking your view by carrying large objects and things can be certainly helpful. So I've talked all about how our nerves inform us of where we are. So it's important then for us to also talk about what happens when these nerves are damaged. So when we have damage, often this is in our nerve damage in our hands and our feet, this is referred to as peripheral neuropathy, okay? Nerve damage that occurs outside of that central core of the brain and the spinal cord. So think of how it feels when you maybe fall asleep on your arm, or if you maybe sat on your foot for a long time. Can anyone share what is that sensation like?
Tingling?
Yeah.
Pins and needles?
Yeah. Pins and needles, tingling, exactly. Sometimes it's even painful. Sometimes it goes numb. You lose a bit of the sensation. People that suffer from peripheral neuropathy often have this feeling a lot of the time, or it comes and goes. And it might also feel like a burning sensation. And it can also involve impaired ability to sense temperature, so extreme hot or cold. And damage to our peripheral nerves can be caused by a variety of things. So it could be an injury, it could be certain medications can cause a bit of abnormal nerve sensation, medications and exposure to toxins or things in the environment. Could be arthritis as well. But the number one cause of peripheral neuropathy is diabetes. So for those people diagnosed with diabetes, type 1 and type 2, both affected the same. After about 10 years from diagnosis, about 40 to 50% of diabetics will suffer from some form of peripheral neuropathy. But how does this happen? Right? So essentially, we have blood flow throughout our bodies, and it supplies oxygen and it supplies nutrients and it carries away wastes. And we need this supply to every tissue, every organ, and every nerve in our body. So if we don't have adequate blood supply to our nerves, we can lose sensation, or we can have altered sensation. And I'll direct everyone's attention again to a diagram up on the screen, and this time it's showing a nerve bundle. And you can see here that the nerve travels along with a blood supply. Okay, your arteries and veins and nerves all wrapped in a protective connective tissue. And this runs all throughout the body like this. Now, in diabetes, something else is occurring. So with diabetes, you'll often have excess sugar in the blood, right? And this makes it sluggish. This makes it slow and kind of sticky-like. And I'm going to show you an example. So if everyone can see here, I'm holding in my hand a tube of liquid with little particles inside. And this is to demonstrate blood in the absence of high sugars, okay? The way blood is supposed to flow. And the particles in the liquid are moving fairly easily through this tube. And now I'm going to show you an example of what happens to your blood in diabetes. Those particles are not, those particles are to represent the red blood cells, okay? And these are moving really slowly, okay? So I'll direct your attention again to the screen. What we have here is a photograph taken at a Body Worlds exhibition, and this is a human foot that has been heavily chemically processed to highlight just how densely packed our blood supply is to our feet and our toes, and just how tiny those blood vessels are. And those blood vessels, some of them are only allowing one blood cell to pass through at a time. So you can imagine if your blood has a high content of sugar in it and it's moving really slowly, how difficult it is to nourish and supply your feet with the adequate oxygen and nutrients that it needs to stimulate those nerves. So if the blood flow is reduced, the nerves are not stimulated, and then this can weaken the muscles in the feet. The feet can then change shape, and when the feet change shape, you're more likely to develop pressure points and potentially then ulcers. And if you have wounds on your feet, wounds don't heal well without good blood supply. So this is a really dangerous cascade of events that can often occur in diabetes that's uncontrolled. Again, on the screen here, we have a couple of diagrams of some typical injury on the top right hand side of the screen, showing pressure ulcers. So these can occur on the pads of the feet, especially if you're flat-footed, but they can also occur on bony prominences, so areas where the bones are really sticking out. If you have a high arched foot, this could be the top of the foot. If you have really long toes, maybe they've started to curl under and you get claw toes, so on those joints you can get injury there. Or a lot of people have bunions. Those are where the bone sticks out at the side of the foot, usually by the big toe. And if you're wearing inappropriate or unsupportive footwear, this can be even worse, and I'm going to talk about that a bit later in more detail. So pressure ulcers are a problem, but also on the left-hand side of the screen, there's a diagram of something called Charcot's foot. So here you've had the nerve damage from the inadequate blood supply, the muscles and supporting ligaments in your foot have weakened, and the bony structure in your foot can actually collapse. And it breaks in the middle, and then you have this abnormal pressure, you get swelling, infection, and ulcers, very difficult to treat. Some loss of sensation, though, especially in the bottoms of the feet, is natural with aging, and the evidence would suggest that this is due in part to a decreasing number of sensory receptors in this area with time, or a dulling of that sensory awareness. Another thing that can happen is a slowing in nerve conduction, so slowed reaction time with age. And this has to do with the protective coating on our nerves. So again, those nerves running all through the periphery of the body, they're like information highways, sending signals to and from what we sense and how to react. So if they lose that protective coating, the nerve conduction can slow. One of the things that really helps to maintain the speed of nerve conduction is B12, vitamin B12. And some of you may have been recommended to take supplements for this. Your doctor may suggest that this would be of benefit for you. It can come in an oral supplement or an injection form. So why do we care about all this? We care about this because we want to prevent injury. We want to prevent falls. So if you have some damage to your peripheral nerves, the first thing you want to do is treat that underlying cause, right? If you have diabetes, take good control of your sugars, okay? And exercise, everybody's favorite word. So exercise is so important, right? Because it not only increases your blood flow, but it improves your balance, it improves your strength. So decreased sensation in the feet can cause postural instability, the way we hold our bodies, and the way we walk. It can cause poor walking mechanics. I could be shuffling one foot and putting all kinds of pressure on one side of my body if I've lost sensation in one foot compared to the other. So the nerves in our feet, we learn, they also tell us where we are in space and where our feet are in relation to each other. So if we lose the sensation in our feet, it's like our feet are blind, right? So very important to work on taking good care of our feet. So if you think that you are suffering as well from any nerve damage and you have pain or discomfort, please speak to your doctor because there are medications that can help to relieve these symptoms. And something else we can do is avoid or at least minimize our alcohol intake. I feel like I'm really bringing down the party here, but it is important. If you're taking even one medication, you need to consider, is this going to be problematic if I have a drink of alcohol? Certainly then if you're taking more than one medication, even more important. But even without medication, if you have nerve damage and you're drinking alcohol, you're dulling your senses, you're slowing your reaction time, right? So this can become very dangerous. And another thing that we want to do is make sure that we have good footwear, make sure that we know how to care for our feet properly. We're going to check our feet, right? So let's talk about foot care. If we're checking our feet, what are we checking for?
Any wounds maybe, or
yes.
Sore spots?
Sore spots, wounds, yes. Anybody else?
Redness, swelling.
Yes. Is there a change in color? Is something misshapen, swollen, right? Very, very good. So we're checking the skin. We want to make sure that there's no cracks in the skin. If you get cracks, you can get infection wherever the skin breaks. Color. No part of your feet or your toes should ever be red, black, or blue, okay? Temperature. Are your feet cold? Are they hot? Is one hot and one's cold? And if so, why? Is there a very normal reason why this has occurred or not, right? If you have blisters, please don't pop them. Just clean the area, cover it. It'll resolve itself, okay? But you want to check your feet. And if you are diabetic, ideally you want to be doing this on a daily basis. You want to keep your feet clean, right? Warm water and a mild soap, and clean and then dry also between the toes. So some people like to soak their feet. It's not really advised to be soaking them for longer than, say, 5 minutes. You want to avoid skin breakdown, okay? And if you have nerve damage and you're not able to sense temperature very well, make sure you test the temperature of that water you're about to soak your toes in with your elbow or something like that before you put your feet in case the water's too hot. And as well with moisturizing, because we want the skin to be intact and soft. Moisturization is great, but again, avoid between the toes. So make sure between the toes is nice and dry because you don't want skin breakdown there. Another way that we can care for our feet is to make sure that the nails are filed or trimmed, and you want this to be done straight across, okay? So not cutting around into the corners, because that actually increases your chance of an ingrown toenail. Now, some people are not as able to reach their feet or even see their feet as they once could. So if this is a problem for you, the best thing to do is if you've got a partner at home and they're willing to help you, they can help you with checks or with grooming, okay? Or if you do need to seek professional help to get care for your feet from a chiropodist or a podiatrist, those are foot care doctors. Or there are nurses in the community that are specially trained to provide foot care. You can at least be checking your feet on a regular basis at home. Some people use one of those handheld mirrors to check the bottom of their feet, okay? But if you have diabetes, again, the professional care is always recommended. Things like corn or wart remedies that are over the counter from the drugstore can actually damage the skin if you have diabetes. Similarly, insoles to support your foot inside the shoe, if they're bought just from the drugstore, that can be an issue as well. So better to be professionally fitted for those items. Footwear. So very important. What are we going to put on our feet? First of all, before you put your shoes on, a good idea is to check inside them, right? Make sure there's no stones, any sharp objects, right? Even a coin, if a coin fell in there, that could be irritating. Or maybe your grandkids have left you a little surprise in there, a toy or something. So just be careful. Have a look in the shoes before you put them on, okay? Socks. You want to check for bulky seams that could cause irritation, or you want to make sure that the elastics at the tops of the socks are not too tight, because that could impair your circulation. And again, with diabetes, if you are prone to any injury on your foot, or you've got a sore just at the particular time, a light colored or white colored sock is good, because if there is any bleeding or anything like that, you're much more likely to see that. If you can't feel it, at least you can see it, right? And that's the thing, if you've lost your sensation and you've got bulky seams or objects in the shoe, you're not going to feel it, but it could still cause damage, right? It's recommended to wear shoes at all times, so not just when you're outdoors, but when you're indoors as well, especially if you're getting up in the middle of the night to go to the bathroom several times, and maybe you're not completely awake and aware, and you need to maybe get somewhere in a hurry. So good idea to have footwear in the home. And if you're buying footwear, does anyone know if there's a better time of day to buy footwear? Nobody's ever considered this. So best time to buy your shoes late in the day, right? Because your feet swell as you go throughout the day. Chances are you're going to get a better fitting shoe if you're looking later on in the afternoon. So what I'd like to do as a final activity today is play a little game, and it's called Safe or Unsafe. So I'm going to put up some pictures of footwear on the screen. And what I'd like you to do is just shout out whether you think this footwear is safe or unsafe, okay? So, safe or unsafe?
Safe.
Safe.
Right. So this shoe has many features of a safe shoe. It has a non-slip sole, it has laces to close it, it has good heel support, it has a wide enough toe box that your toes are not all cramped, and it's made of a breathable material, so leather in this case. about these?
Unsafe.
Yeah. Yeah, flip-flops, right? You're going to flip or you're going to flop, either way. Because really, you're not only going to trip over something in your surroundings with these on, you're going to trip over your own feet and the shoes themselves, right? What about these?
What do you say?
Yeah, they look pretty good.
Okay, so yeah, these are a great example. These are sandals, but they have many areas where you're supported. They have closed toes, they have good heel support and ankle support. What about these ones?
Unsafe.
Yeah. Sorry, ladies, but when you have heels, what's happening here is all your weight is forward, okay? And pressure is on the ball of the foot. So, no, not a good idea, not very helpful. What about these ones?
Maybe they look comfortable for the person who had been wearing them for the last 30 years.
Yes, that's a really good way to put it, yes. So, these might have been safe shoes at one point in time, but if you look closely, you can clearly see that the soles are worn out, the laces, the seams, everything, right? Unsafe. How about this one? What do you think? A Croc.
Unsafe.
Yes, thank you. So Crocs are unsafe. These shoes, they're not fitted for anybody's foot, okay? They are made of one uniform, unbreathable material. So your feet are likely to sweat inside, or I know people really like to wear them when they're out in the garden specifically because you can get your feet wet in these shoes. But now your feet are going to slip and slide inside this ill-fitting shoe. And even if you use that heel support or strap, it's bendable, right? It moves around. It's not fitted to the foot. So these are very dangerous, actually. Much better to wear a good old-fashioned rubber boot. But now they make them in all kinds of pretty colors for us ladies, so much better option. And finally, what about this one here?
Probably unsafe.
Yeah, so this is a slipper, obviously, but there's no support in this. A better option is something like this. So it has an actual sole on the slipper, and they make these for men as well, but it also has an adjustable Velcro support to fit it securely around your foot. So in summary, what we've talked about today is knowing where we stand, right? We need healthy nerves to know where we stand. It's our central nervous system and our peripheral nervous system working together to sense things and then enable us to respond appropriately. We've also talked about nerve damage, how we need good blood supply to stimulate the nerves, so how damage occurs, and the added difficulty if you have diabetes, how nerve damage can be occurring. And then finally, we've talked also about foot care and footwear. So remember, people, your feet are for life. If you wear them out, you don't get to trade them in for a new pair. Really important that all of us take care of our feet well throughout our lives, whether we're suffering from peripheral neuropathy or not. And again, if you have problems with your feet, best thing to do is speak to your doctor or a foot care professional. We can do things like sensory testing, help with regular grooming and maintenance, or you can be fitted for appropriate safe footwear. So I'd just like to say thank you to everybody for listening today. I hope that it was informative and helpful. And thank you to our audience at home as well for tuning in today. And thank you very much.
So I wonder, Holly, your role as our nurse specialist that focuses on diabetes, what would be some things you would do if I had diabetes and was coming to see you? Can you talk a little bit about what you do for the family health team?
Yes, so for the family health team, as a registered nurse, providing special care to our diabetic population, if somebody comes in for a regular diabetic checkup, we'll check their feet every so often for sensory perception as well as good circulation, see if there's any changes in the shape of the foot, if the footwear is supportive or not, and if you're able to care for your feet on your own or not. And if you're not, we can always provide those links to get care in the community. Yeah.
Thank you.
Yes?
How important is drinking enough fluids in terms of getting the proper circulation?
Well, staying hydrated is important for your mental awareness as well. And as you age, you know, sometimes your ability to detect thirst is reduced. So you might not know that you're dehydrated and need to be drinking more. So that's something that we always want to know about. In terms of blood flow, yeah, it's important to drink enough so that you have adequate volume of fluid in your body, but it has to do not just with adequate blood supply, it has to do also with staying mentally alert. Yeah. Yes?
There's research out there about the different types of soles that you can get for your shoes, including some that have different, I'm going to say, you can rephrase this, but the different little bumps on the actual sole itself,
Yes.
so that it will help with those nerves.
Yes, so you're referring to the fact that there's some ridged insoles, right? So this may be good if you're having some loss of sensation, perhaps from a reason other than diabetes. If it's a diabetic peripheral neuropathy, you want to avoid any unevenness to pressure points, right? And so I know that the thought behind the ridged insoles is to stimulate some sensation, but that's not always helpful if you have a foot deformity and you have diabetes. That can potentially create some problems. So I would just always refer someone to a foot care specialist, again, to be specially fitted for the appropriate insole. So I think that needs to be determined on an individual basis whether something like that is appropriate. Yes?
There's also those vibration machines. You can pick them up at the local pharmacy,
Right.
drugstore. And what are your thoughts on those?
So, yes, there are those devices you can buy from the pharmacy or home care shops that are supposed to stimulate blood flow, right, and improve your circulation, that you would use at home. Some people have reported that they feel better when they use them. The evidence supporting how well they do actually improve circulation is a little bit lacking, okay? So I think probably getting up and walking around, doing things like rotating your ankles or wiggling your toes to get the circulation going is much more beneficial than sitting and using a device that's supposed to do the work for you. Yeah. Yes?
Holly, when it comes to peripheral neuropathy, is that a permanent condition? Is that once it develops, it's going to continue and progress perhaps and worsen? Or is it something that someone, if they start to feel those initial signs, they can actually start to do something to reverse it?
Great question again. So the question that came was, if you have peripheral nerve damage, is this something that's permanent? Or is there something you can do to make it better? If we can catch it early, we have a better chance of preventing it from getting any worse, okay? But damage to the peripheral nerves can actually be improved through proper care, right, as we've discussed here today, and the symptoms can be relieved by medications if we can catch it early, and that's at least one of the silver linings that we have about this condition. Absolutely, yeah.
Thank you very much, Holly, for that amazing presentation. I hope you at home found it valuable and informative. If you are having problems with your feet, talk to your family doctor. Also, Holly mentioned the importance of exercise. If you would like to know where those local free exercise classes are in your community, stay tuned to the end of the presentation and contact information will be displayed on the screen. Our glory is not in never falling, but in rising every time we do. It takes an entire community to prevent a fall. Thank you.
For more information about the free Smart Gentle Exercise programs in your area, check out the Vaughan Smart website at www.vonsmartexercise.com or contact Smart Program Coordinator Kelly G by phone 519-323-2330 extension 4954 or by email at kelly.gee@von.ca. The preceding program was brought to you by Wightman TV and Bruce Telecom.